So let me just make sure I'm understanding because
All right. Hi, everybody, and welcome to the SIH Second Act New Technologies and Testing class. I am here with our presenter today, and his name is, drum roll, Sean Mc. I am going to butcher that, so I'm going to let him introduce himself. But before I do that, I will just remind you all that you can ask questions during this presentation. There is a chat box below your screen that you're watching, so you can type in any questions and we'll get those asked at the end of the presentation. Um, Also, make sure to sign up for the rest of the November classes we have coming up. We still have about 3 left, so make sure to check those out. Without any further ado, I am going to hand it over to Sean and kind of let him take it away and kind of explain what he does and the kind of testing that we've been doing throughout this pandemic. So, Sean, I will hand it over to you and let you take it.
thank you so much, Kayla. Again, my name is Sean McGann, and I work with PCR testing, which is a good way to identify quickly what a clinician is working with in terms of infectious disease. So I look forward to working with all of you and kind of understanding what are you looking to gain from today's conversation, as well as how we
I can hear
can
him, but
provide some good opportunities for those who are interested in getting more from their infectious disease testing. So I am looking here. And I'm hoping to be able to share some content with you. All right. So this first, I'm having a hard time seeing. I hope everyone can see. Um, awesome. So most people will be familiar if anyone's gotten a test for an upper respiratory infection, they may be familiar with this procedure. This is the nasopharyngeal swab, and the clinician looks to always get the best possible specimen to be able to run a test to see what pathogens are present. So that could be your bacterial pathogens that may be causing an illness. That could be viral pathogens. As we know, one of the big viral pathogens that we've seen recently, as Kayla already mentioned, is SARS-CoV-2, which is one that a lot of people may have had this test for recently. I'm very interested in hearing from the audience of what questions we might have, but I'm going to give an overview first. I'm trying to find my other files here. There we go. Awesome. So hopefully this is large enough to where we can see. We mentioned COVID-19. Testing for infectious disease will identify up to 11 pathogens. So anyone who's feeling those aches, congestion, cough, diarrhea, fatigue, I'm sure everyone here has probably been asked if they were feeling these things to be able to get into a doctor's office or anything. And I'm always impressed with how well people just kind of rattle these off. You can tell they're asking it like several hundred times a day, and they've got all these ready to go. So you guys will probably be very familiar with those associated clinical presentations. For some of the other ones, you may be as well. We like to really hone in on, hey, how can we, as testing for infectious disease, find out for the clinician, help them determine, hey, what is going on for this individual so they can recommend the fastest treatment to be able to heal this issue. The benefit of PCR testing versus some of the other testing is it's highly accurate, thorough, and quick. We may all be familiar with uh, finding out what pathogens are present through culture. And, culturing through a petri dish, we all did these experiments probably at a younger age. PCR is looking at the same things, but through PCR technology, we are able to fast track that culture to where in the past, a culture may take, up to a week to be able to get that specimen that we're looking at. PCR, for those who are not familiar, stands for polymerase chain reaction. And it's a way to be able to tell in a small sample, a small specimen of DNA, what is going on and what pathogens may be present that could be causing the person to feel all of these sickness effects that may or may not be contagious, may or may not need to be addressed very quickly so that we can limit the spread of things like COVID-19. So this is a good overview, and as with all of these materials, I'm happy to share this after the presentation with anyone who would like that. One of our most popular ones is our gastrointestinal. Our gastrointestinal does things that a lot of people are not able to do in terms of identify up to 13 pathogens for someone who is having symptoms of diarrhea. So we're able to quickly identify, hey, is this something that is linked to foodborne illness? Could this be something that is a different bacterial, E. coli, that sort of thing? What is going on here so we can find out and help the clinician find out what is the best way to move forward? Is this something very serious? If we're seeing a lot of this in an area, could that be linked to some sort of outbreak? Sometimes we see this, and those of you in the Carbondale area, luckily I'm not aware of anything like this in the local area, but we have a beautiful splash park. I love to take my kids there, but sometimes we see in areas, hey, there could be waterborne pathogens that are causing illness. With this gastrointestinal, if that's something going on, the providers can get this information very quickly. We're talking they're quickly taking a specimen of that stool or a rectal swab and being able to quickly say, hey, this is what's going on for this patient. That way, when providers are sharing information into their databases and systems, if we see something pop up, for instance, a pathogen that may have been spread in a certain location, we can, and everyone can work together in the community to quickly find that out. We're not waiting for a long time while more kids are potentially getting sick, more people are potentially getting sick. We're able to identify it very quickly. And that's a huge benefit of PCR testing. PCR, a lot of people are knowing this term because that's the gold standard of COVID-19 testing. And it can be the gold standard in a lot of other areas. So I'm eager to hear what kind of questions people have because I would love to address those and anything that I don't know the answer to. There's some great individuals much more well-versed and intelligent than me back at the lab, and I'd love to reach out to them and get to know. Because the cool thing about Diatherix, which is the company that I work most closely with and work for, they are at the forefront of PCR technology and have been for over 12 years. Before some of us heard of the term PCR, the research and development team over there, which I've had the privilege to meet with, has done an excellent job. In giving some historical context, which I hope to be able to find the slide where I have some of this as well. But they have been able to identify through PCR technology things that the CDC, clinicians all across the nation have celebrated as cutting edge PCR technology in infectious disease testing. One instance of this is back in 2009. Does anyone remember H1N1? Diatherix was at the forefront of being able to identify H1N1 in pathogens, in specimens, I should say. They were the earliest of any lab in being able to identify them with PCR, and they were the first lab to get clearance from the CDC and approved to say, hey, this is the best way to test for H1N1 at this time. That led to a lot more innovation, a lot of spread of stopping infectious disease in its tracks, and we all got a big dose of this in March 2020, when a lot of our lives changed. March 2020 was also the time where Diatherix, through research, through conduct, was among the first handful of labs in the United States to be approved for PCR testing for SARS-CoV-2, which is the best way to identify a COVID-19 infection. And that has been a huge area of growth for Diatherix. And the cool thing is, with all of that growth being celebrated as the most accurate testing on the market, we've been able to share with a lot of different communities and work with a lot of different providers to see how we can help them achieve better patient care. So we love partnering with people, and it all comes down to technology that allows for the fastest, most thorough, most accurate results possible. I'm going to zoom in here a little bit. Hopefully you can see that. We mentioned the ability to identify what bacteria is present. With other techniques, it's difficult to be able to tell what bacteria is present if someone has been taking certain medications. Because of the techniques here with TEM-PCR, which is target enriched multiplex PCR, very small specimen is needed to be able to multiply and be able to get quick, thorough results, looking at multiple pathogens at once. This is key technology in being able to get the fastest results while also not sacrificing anything in terms of reliability and specificity of what we are looking for. You don't want to get a result that, hey, we didn't get quite enough specimens, so we're just going to assume that pathogen is not present. We want a high degree of specificity and sensitivity combined to be able to say, hey, this is the most thorough result you could possibly get. So whether or not someone has been on certain medications, this process, this technology of target enriched multiplex polymerase chain reaction will be able to tell, hey, this bacteria is present, whether or not they've been using certain antibiotics. So for instance, if someone is taking an antibiotic, we'll still be able to get an accurate test result for them. We are able to test for multiple pathogens at once off of just a small sample. And oftentimes it can be non-invasive to where you could get a result just from, say you had a respiratory infection, you could get a result from just uh, coughing up a little something, hawking up a loogie. We can get a good result off of just a small specimen there. If we're looking at genital health, which also this is very key, we could get a good result just off of a small, less, actually 1 milliliter of urine will be able to heed a accurate result for these pathogens. Some of these pathogens are difficult to culture. So even though this is a beneficial technology in speed, it's also going to get you as accurate or more accurate results for the tests that we offer. And again, we're looking at, for each pathogen that they're looking for, the research and development team is putting in multiple primers to be able to identify that, and off of a small amount of a specimen be able to say, hey, this is present, this is not present. Get those results to the doctor very quickly so they can do what they do best in patient care. All right. I would love to hear if there are any additional and questions at this time. Kayla and Kelly, thank you so much. I've got everything I need here, so I really appreciate that. Can you guys see the screen well and everything?
It just dropped off. Are you still
Oh,
sharing
yeah,
a
let me
picture or anything?
see
But I
here.
do
Let
have
me see if I,
questions while you're pulling that up.
yeah, excellent.
So when did this type of testing start?
Absolutely. So really, PCR testing was developed in the 1990s, and among the people who have been chief in developing, I believe there's been um, some significant um, prizes to those who were chief in development. And one individual who was instrumental in developing uh, PCR technology started working closely with those who started Diatherix in Huntsville, Alabama, and they were able to develop, through learning more about PCR technology, they were able to develop a step above, which is the target enriched multiplex PCR technology, able to make that some proprietary technology to where this is something that can really help people. So from, the past 30 or so years, PCR is continuing to develop to the point where, people are looking at, hey, what is the best way? What can we really identify with this? How can we help this improve people's lives?
Awesome. So we know that you've mentioned SARS and you've mentioned COVID, but what other kind of testing do they use this kind of system for?
Absolutely. Let me make sure I can share this real quick. Hold on. I think I just need to switch which window I'm using.
Yes.
Um, all right. Awesome. All right, let me do that real quick. I'm going to share. Awesome. This should work. All right. So, can you guys see our copy of the test menu? Excellent. So, right now, as of November, I'm going to go through a few of the tests that we offer, and always innovating, always trying to find new. We actually have a skin rash panel that we're getting ready to premiere at the beginning of next month. A lot of people are really excited about this. Um, for people who have young children, I know I'm excited about it. It's tough. Whenever you start to see a rash develop, you want to know very quickly what it is. And the clinicians have told me, it's very difficult in those first couple days until that rash has developed some of the more distinctive traits, which for a lot of rashes doesn't occur till maybe day 3, day 4, day 5. What is this rash, is this something that we should really be concerned about, especially in young children? We have actually 4 skin rash tests that the team has been working on to get ready to premiere next month that will identify those type of skin rashes very quickly, especially in young children, to be able to determine, hey, um, this is the right course of action for the clinicians to recommend, so we can know, hey, how serious is this? Because we all know with young children, especially, it's scary to start to see some of these things develop. So if we can nip the potentially uh, contagious, potentially serious health side effects, skin rashes, if we can nip that in the bud very early on in the process before it started to turn into what we see on the pictures as some of the more distinctive rashes that we can make a decision on, that's going to help patients. That's going to help clinicians be able to do what they do best. So we're really excited about premiering that. So that's the only one that will be available soon that's not on here. This side of the test menu is all respiratory. It's all respiratory illness. So we have a wide variety of panels. So the clinician will select one panel, for instance, the viral respiratory panel here. That will give them results, detected or not detected, for all of these different pathogens. The reason why a panel that can detect all of these different pathogens at the same time is very important is, say you went in to get a COVID test and you're very sick, you're having some symptoms, like we talked about earlier, we all know the symptoms, you're having some of those symptoms, and we have either a detected or not detected for COVID. That's important information to know that whether COVID is detected or not detected. But say we get it not detected, I'm still sick. I still may have something viral. I may have something bacterial. I want to know what's going on. So if we're able to test with all of these in the panel simultaneously, it's really, really helpful to clinicians to be able to recommend the proper movement forward, especially with children. Pediatricians are really uh, one of the uh, most they they utilize these tests the most, um, and they use a lot of uh, the panels, such as the pediatric respiratory panel. If I could highlight that real quick, it's one of our most popular panels. Um, so we're able to, off of just one specimen, within one day, get you results. We'll send to the provider, hey, detected, not detected, for flu A, flu B, SARS-CoV-2 can also be added to this just off of one specimen. All of these, we're talking pertussis, which is really important to find out for young children. Um, all of these bacterial pathogens, what is going on? Because we know that sometimes when people are sick, say someone has something viral, and I've learned this from a lot of clinicians. Say someone has something viral, they may be more susceptible to a bacterial infection, so they may have multiple infections going on at once. So if we're able to get the clinician this information, get the healthcare provider this information, they can do what they do best in treating this illness very quickly. A lot of people reported to me an unprecedented year for RSV that they've never seen before. And as we're learning more about, as different viruses develop, as bacterial pathogens present in different ways concurrently with these viral pathogens, we are constantly collecting research, sharing that research not only with the doctors and nurse practitioners that we work with every day, but we're assembling all of this, sharing that information with, on a national level, Centers for Disease Control, which then disseminates it to state and local health departments, so we can help really determine, hey, how can we make our community safer? How can we learn more about what ails our community, what ails our children, and be able to move forward with research. So this is a taste of what we offer in terms of respiratory. Um, we mentioned bacterial infections going on concurrently with viral infections. If you see here, our COVID-19 panel, which was developed again very early on, we're talking March 2020. Early research indicated that people getting really sick with COVID were really getting sick in the hospital with some simultaneous bacterial infections. So if we can know what's going on very quickly and we can get a result for SARS-CoV-2 and also the most common bacterial infections that would be going on concurrently with the SARS-CoV-2 viral infection, then that's really helpful in helping make sure that people don't get as sick as they could be. So this is really important moving forward as well.
So I do have a
Flu
kind of
Plus,
question
sorry, go
on
ahead.
this whole part. So
Yeah,
there are a lot of these tests, obviously. So is most testing that's done, is it a or PCR test, or is
yeah,
it not, or
absolutely.
how do
All
you
of
know?
these, yeah, exactly. All of these are PCR tests. All of these use that target enriched multiplex PCR technology. So they're all done in the same lab and we're able to get you next day results. But all the tests are unique. So with that target enriched multiplex PCR technology, they all need different plates. So we're able to run, say it's an ear, nose, and throat. We can run multiple specimen for ear, nose, and throat simultaneously because that plate that they're able to run this test off of through the process is looking for all of these simultaneously. This plate has these tiny little dots that you can't even, like, if you were to hold up one of these plates, you can't even make out with your eye. But the way those dots are designed are able to indicate through the DNA process, hey, this is present, this is not present. So all of these are PCR tests, but these different panels are unique, using unique plates to be able to detect for all of those pathogens at the same time. So just off of one specimen, we can say, oh, yes, what we're seeing here with this specimen is consistent with RSV. We also see this MCAT here. So we're getting the physician, the provider, that information simultaneously. So everything that Diatherix does, everything that we're sharing today is using the PCR technique, but they're all done within that technique. All of these panels are done on a unique basis and tested in a unique batch.
Now, Sean, most of the COVID testing is PCR by the vast majority, right? So if I'm in my doctor's office or I'm running into the emergency room and they're running a panel of tests, as they call it, how common is the PCR test being used in doctor's offices or in the actual hospital settings labs?
Yeah, so that's something that's really grown uh, from uh, from really through COVID is the ability to do point of care PCR testing to where if a doctor's office is to invest in a machine and be able to run a PCR test in-house, they can have a machine that, like I was talking about, having all the different targets that we're looking for. They can have a machine that will run and give you a result for SARS-CoV-2. And some of the machines have even developed to be able to have multiple pathogens on there to where a point of care PCR machine will be able to give you a result in just usually 2 to 3 hours. So that's something that's really been a cool development out of, hey, sometimes the best innovations are through times of tragedy and times of hardship. So PCR is one example of that. There's been a lot of innovations. A lot of people are seeing how this technology can really hopefully save lives. And so it's grown a lot. So Point of care PCR testing has grown a lot. The one thing about there's certain, just like with anything, there's certain drawbacks. So to be able to uh, utilize point of care PCR testing, it takes a significant investment on that provider's part, and it takes a significant upkeep and being able to make sure that as viruses develop, we're all very familiar with all the different variations, variants that SARS-CoV-2 has gone through. A benefit of a large lab setting is that uh, constantly looking at this, constantly looking to adapt to any variants that might present themselves and make sure the test is the most accurate of any variant. So whether that was alpha, beta, delta, mu, whatever variant that has developed over the course, making sure that, hey, we in the lab know that our test is the most reliable and able to detect the different variants because we're looking at multiple things. Guys, we've learned a lot over the past 2 years about the spike proteins as they manifest in different coronaviruses. So we're able to not only look, some PCR tests just look at, hey, is this gene present? Is this spike protein present? Um, the slide that we shared earlier with looking at multiple primers, multiple targets, we're able to be the most accurate and thorough test on the market in being able to say, hey, we're looking at multiple things. We're not just looking at, for instance, a S gene or a spike protein, that sort of thing. We're able to say, hey, since we're looking at multiple things, we're comfortable and confident that this is a very reliable test. And when running controls, because to be an accredited lab, you have to run controls that different organizations such as CAP send along, that we are the most accurate lab. So, point of care testing is really nice in PCR testing is really nice in being able to get very quick results, which is so important. But we're continuing to look at and develop, making sure that these don't sacrifice any accuracy or anything like that. Continuing to develop always.
Kayla, do we have some other questions?
Yeah. So now that I know some about these PCR tests, do I just ask for one, or do most doctors just recommend them, or how do you even go about getting one, I guess, if you feel like you
Yeah,
need?
yeah, absolutely. Because I think, um, again, COVID was a great lesson, unfortunately, for a lot of us. Um, and a lot of people have learned about this. So other tests, you may have heard of like a rapid COVID test. Um, Typically, the rapid COVID tests out there are looking there. It's not a PCR test. It's looking, uh, it's an antigen test. So it's looking for certain things, but it doesn't have the degree of specificity and sensitivity that a COVID test, I'm sorry, a PCR COVID test will. It doesn't have the, so as a result, with an antigen test, it's more likely that you may have a false negative, meaning, hey, you really do have that pathogen in your system, but because the antigen test isn't as thorough in looking at what's going on, uh, the test right now reads negative, but you're actually positive and could be spreading it to other people. You could also have a higher chance of a false positive, which is rare, more rare than a false negative with the antigen tests, but does happen. So you want a more reliable test. And so if you're getting a COVID test, it's always good to ask, or a flu test or a uh, strep test. It could be anything. It's good to ask, hey, what type of test is this? Is this an antigen test? Is this a PCR test? PCR is the gold standard for a lot of these, and clinicians know that most of the time, if you're waiting, more than a few hours, more than 15 minutes really for your test result, it's most likely a PCR test, because those antigen tests are the ones that you can test yourself at home and you don't have to send it anywhere. You're able to get a quick, within 15 minutes test result, which is good to have. It's a tool for the tool belt. It's great to have and be able to identify, and those should be used, absolutely. But it's also important for people not to get a false sense of security from a negative antigen test. And it's always good to run a confirmatory test, PCR.
Awesome. So this kind of goes into the next question is each test, does it take different amount of time? I know like sometimes COVID tests take 24 to 48 hours. Are the other tests the similar amount of time, or does it vary?
That's a great question. All of the tests that we offer take the same amount of time. So for us, what the process for us is, the provider takes a specimen in the lab, and then they have it picked up at their office, and then it gets flown to our lab. So we do everything logistically to get that from, hey, if I was to get swabbed this afternoon, it's being done in this afternoon, it's actually being flown as soon as it gets transported, and then it's in the lab at 6 a.m. the following morning. It's tested, and like I said, the different tests are tested together throughout the day. And if there's anything that indicates that, oh, there might be a problem with this test, then that entire batch is rerun. We don't want to give people that false sense of security. We don't want to give people compromised test results. So all of our tests, you will get results the next day. So if you were swabbed today, it gets to our lab the following morning, and we are electronically providing those results to your provider by the following afternoon. So in our instance, all of our tests are next day. Because we're a specialty laboratory, we're able to do that. Some other laboratories might not be able to. For instance, when we're talking about some of the other tests, for instance, looking at gastro or genital health, oftentimes these might take longer. So you may be used to waiting, 5 to 7 days for some of these test results. But since we are a specialty laboratory and we've really invested all of the proceeds from growth of business with COVID back into our laboratory, we're able to get you all of these results next day.
That's great. Another kind of question is, are all the tests, are they nasal swabs, or does it depend on which test?
Awesome question. All right. So this is a great document for that. This acceptable specimen sources highlights all of our tests and every specimen type that has been proven to heed accurate results. So accurate, thorough results. The reason is we realize that there's all sorts of barriers sometimes. We heard this a lot early on in COVID when nasopharyngeal swabs, which is that first graphic that we showed, all the way up. People are familiar with, oh, I think they got a chunk of my brain out on that one. Anyone who's gotten that, you probably remember it. You probably teared up a little bit in your eyes. It's not the most comfortable procedure ever. It is highly accurate and, is a really good one for any upper respiratory infection. But some people, we might have the need to test someone who has special needs, or people with a variety of disabilities, or just just have gone through trauma where that's not a comfortable process, that's really a barrier to where I'm not getting that test if they got to stick that all the way up in my brain. And it's not actually your brain, but I do know some people feel like it is. Um, so what we're looking at is, hey, what can we do to eliminate barriers that clinicians face, that patients face? So our lab has done the research to be able to provide all the acceptable specimen sources that we can really keep good, accurate, thorough results off of. So we're able to share all of that with the provider and say, hey, if getting a nasopharyngeal swab is a barrier, hey, just have them hawk a loogie and you can swab that. That's a non-invasive procedure. If you're looking at, hey, the symptoms, for a wide variety of respiratory things, it's not always upper respiratory where the symptoms, it could be lower. Okay, so let's look at, hey, it could be a bronchial washing, anything that we can get a solid result off of. We want to free up the clinician to be able to make those decisions to where, hey, I can get you a highly accurate result and not have to worry about any barrier that may be in place.
You know,
One time,
oh, I wanted to share with you real quick. We've been assisting with working at the testing sites, and this particular issue has come up before. Someone had a tracheotomy, and where would you get the best specimen from? So sometimes you don't realize that there are some barriers to getting testing done, and I really appreciated being able to see the huge variety of means that you could catch a sample and then be able to get an accurate result.
absolutely. And another place where we've talked a lot about respiratory, and that's on the forefront of a lot of people's minds right now. But another place where we see this a lot is our genital health testing, to where a lot of people, for a wide variety of reasons, are very apprehensive of getting an exam or getting a swab. Again, could have gone through trauma. And and when we're talking about children too, a lot of times, um, you know, culturally, for a wide variety of reasons, having to do that procedure is sometimes a barrier. So we're able to open things up by being able to test for a wide variety of genital health pathogens with just 1 milliliter of urine. So that opens things up as well. There's all sorts of barriers when we're talking gastro and H. pylori. There's all sort of barriers to stool collection that we see all the time that a lot of people have dealt with. One thing that we hear often is, oh, hey, you got to tell the patient to go home, get the stool sample, get a lot. They got to put their gloves on. They got to put that in the tube themselves, everything like that. They got to store their stool in the family fridge until it's time. Nobody wants their stool in the family fridge. So the nice thing about the TEM PCR is that it takes a very, very small specimen to be able to get highly accurate results. We're not talking about a large amount of stool. It's less than it takes to use when you're wiping after going to the bathroom. And for our gastro test, no stool is even necessary. A rectal swab or an anal swab would suffice as long as we get a good specimen. We can run for all of those. And again, culturally, there's a lot of different cultures that have issues with, and stool collection can be a barrier. So if we're able to eliminate that barrier and still be able to get high results, accurate, thorough results, that's one place that we can help. So it's all about eliminating any barriers that present themselves.
Do we have any other questions, Kayla?
Those are all of my questions that I have in.
All
Um,
right. Sean, I really appreciate the graphics because I like to see what the options are. And when you put up that list of, we can test for all of these in one sample, I think that makes a huge difference. I know your background is thinking of, pediatrics with your children, but for us with our 50 and over group, the looking at COVID and then also looking at pneumonia, that's an issue in the hospitals that the sooner we can get that within 24 hours and know what we're treating really makes a difference, not only in the treatment for the patient, but um, obviously the spread of any of this. So I know PCR testing is invaluable in that respect.
Absolutely. That's a great point, Kelly. And that being able to identify those very quickly. We've heard of a lot of instances where, some of these pathogens, if you can identify it quickly, if you can treat it quickly, it could be life-saving, like you mentioned. So it's very, very important. And I'm glad that we were able to have this opportunity to share some of this information so that if there are patients out there, to be able to hopefully better understand, because when you're sick, it's really tough. You're hit with so much going on. So hopefully, if we can learn more and understand more about this, be more comfortable and confident when speaking with a clinician.
I had to laugh as you're going through this. All I'm thinking is the old TV show House, where it's like they put up the big bulletin board and what could all this be, and they write it all down, and then they do test after test after test. That show would never have existed if we had PCR testing more than 30 years ago. So I do want to
Absolutely.
Yeah, I do want to thank you, Sean, for joining us today. Um, the technology is something that we have to accept and we have to start working with. And the more we know about what's available and what's out there, the better decisions we can make. And certainly helps our clinicians to know how better to treat us. So I really do thank you for joining us. Um, and those of you who are going to view this later, we really appreciate that. Those who are with us right now, you will be getting a survey. So please make sure to fill out that survey for us. So if you have other questions or have things that you'd like Sean to share, we can definitely get back with him. Remember, somebody who has registered will be getting something in the mail from us, a small little gift. Thank you for registering with us today. And thank you so much, Kayla. I apologize in the beginning. For some reason, I was having technical difficulties. So we are all back and all is well. So thank you again, Sean.
Thank you both so much. I appreciate it so much.
Yeah, thank you guys. And I just wanted to add with Kelly, I will also attach some of these things that Sean shared with us so you guys can have them at your fingertips. So again, thank you guys, and we'll see you at the next one.